So, good morning, ma'am. So, for today's video, I will be performing essential intrapartum and newborn care. So, the concept of this method is it is an evidence-based standard for safe and quality care of birthing mothers and under newborns. Within the 48 hours of intrapartum, labor and delivery, and a week of life for the newborn. So, for the objectives of this procedure is we need to understand the concept of the World Health Organization Partograph to explain to the mother the significance of the graph and monitoring the progress of labor with the use of partograph, and then lastly is to record the observation accurately and to interpret the record of findings. So behind my back is where the materials and equipments are put in the side table. So we need 2 pairs of gloves, a vitamin capsule, a syringe, 1 ml, and then a rectal thermometer, thermicin ointment, weighing scale, and then cord clamp, a cotton balls, and then a sterile gauze, tape measure, a towel or linen, and also we need a bonnet for the baby, and then Hep B vaccine, and also we also need the doll for example as a baby. So first and foremost, we need to prepare the woman during the first stage of labor. We need to explain to the mother or the woman and her support person what will be done and encourage some questions. And then we need also to review the woman's chart, for example, the natal card and partograph. So the rationale of this is to ensure the accurate data and to impart them with knowledge about the pregnancy. So ma'am, I'm Alia Ducia Antonio, and I will be your assistant nurse for today for performing the essential intrapartum and newborn care. So next procedure is we need to prepare for the childbirth. So we need to check all needed equipment and instrument supplies for delivery care. The essential newborn care and newborn resuscitation are available. And then we also need to make sure that the room is warm, ranges around 20 to 25 degrees Celsius, and make sure that all of the windows are closed. Including the doors should also be closed. And then the rationale of this is to avoid medical errors, and also warming the room ensures safety for the newborn. After we provide the privacy of the patient is we need to sanitize our hands or for the hand or hygienic care for the hands. Then after that, we need to wear the gloves. So the rationale of putting the glove is to avoid contamination. And so we need to ask the mother to lie down first. So, and then place a sterile linen or towels on the mother's. And then the rationale of this is to keep the sterility to ensure the vernix caseosa is still present. So when the head is delivered or the baby is delivered or already, wipe the mouth and nose with gauze to provide adequate airway breathing for the infant. And then discard. Then after that, we need to do a immediate and thorough drying within the first 30 seconds. And then we need to dry the newborn thoroughly by patting, making sure that the vernix caseosa is not removed, and thus a quick check on the Apgar score of the newborn while drying. Then the rationale of this is to drying the baby helps maintain normal temperature, and also the Apgar is used to test if how the baby actively responds.
Number 3 rational.
So we need also to check the Apgar score of the newborn while drying or after drying also. Then next is we also need to perform the early skin-to-skin contact between the baby and the mother. So we need to maintain prone position of the newborn on the mother's abdomen, and then covers the back of the newborn with the second towel or linen and head with bonnet. And then for the rationale of this is the early skin-to-skin contact is associated to promote baby sensation of mother and baby relationship. We also need to observe the initial crawling reflex of the baby, and then place the ID band on the ankle of the infant and does not separate from mother unless the newborn with severe chest indrawing, gasping, or. So next is we need to perform the properly timed cord clamping. So we need to remove first the set of gloves. And then discard it. Then the clamps and cut cord after cold pulsations stop between 1 to 3 minutes, and then puts a plastic clamp or thick tightly around cord at 2 cm and the forceps 5 cm from the newborn's abdomen, and then cut it between the clamp with sterile instruments. And then the rationale of performing a proper or right time cord clamping is, first, accurate nutrient needed for the infant. And then we need also to observe blood. If blood oozes, place a second clump between the skin and the first clump. And also we need to administer 10 international unit oxytocin intramuscular to the mother 1 minute after the delivery of the baby. And also, so the rationale of giving or administering oxytocin helps to stimulate uterine contraction. So we need a syringe and then get a So next is, which is the non-separation for early breastfeeding. We need to leave the newborn baby on the mother's chest in skin-to-skin contact. And then for the rationale is it improves physical and emotional needs shared by the mother and the baby. Go. And also we need to check for the feeding cues like the opening of the mouth, tonguing, and licking and grunting. Also, we need to counsel on the positioning and attachment. And then we also need to observe for the signs and good attachment, like observe the VF for 4 minutes, like the chin must be touching the breast, the mouth is wide open, lower lip turned outward, and more areola seen above than below the mouth. So the rationale of this is to ensure good attachment and proper take-up of nourishment. After that is we need to take care of the eyes of the baby. So we need to wipe both eyes with sterile OS or the inner outer canthus, starting with the farther eye, and then using the thumb and index finger open the eye and apply eye antimicrobial from the inner to the outer edge of the eye. Do the same for the other eye and apply within 1 hour of birth. And then we also need to make sure that the tip of the tube does not touch the eye of the baby or the other objects. So the rationale of this is to prevent conjunctivitis in the newborns. Need to perform the non-immediate intervention. It should be given within 6 hours or after the full breastfeeding is completed, and it should never be made to complete with the time-bound interventions. And the rationale of this is to promote mother and child relationship. Next thing we need to do is to administer the vitamin K prophylaxis. So administers vitamin K prophylaxis. So the rationale of this is to prevent bleeding. That's why vitamin K is needed. We need to explain to the mother first that an injection will be required to prevent the hemorrhage of the baby. Then also, we also need to administer hepatitis B vaccine on the vastus lateralis and BCG vaccine on the right deltoid. Rationale of this is to protect the infants from hepatitis B and to note any possible immediate action and interventions.
Lapit na naman.
So after we administer the vitamin K and hepatitis, we need to assess the newborn for any birth injuries, malformations, or defects. And also we need to obtain anthropometric and also the measurement weight, the head, chest, abdomen, length, and vital signs. So lastly is we need to perform decontamination, cleaning, and sterilization. We need to ensure proper disposal of waste and decontaminate of the equipment and supplies that can be used. And then we need to remove the gloves and wash hands. So the rationale of this is to prevent any transmission and contamination of equipments and supplies used. That's all for my return demonstration for